Hello friends, welcome back to Dental Info. The topic we will be discussing today is Bionator Appliance in Orthodontics, which is a very important topic under myofunctional appliances. We have already discussed important points in relation to the different myofunctional appliances. If you haven't watched the video, just click on the I button above. The bite plane, oral screen, lip bumper and construction bite have been explained in that video. Today, let's understand more about the Bionator. So, let's get started. Before we start, please make sure you subscribe to the channel and click on the bell icon to receive a notification when we release a new video. An appliance which changed the posture of the mandible by acting mainly on the tongue was discovered in 1960 by Wilhelm Balder. It was a type of a myofunctional appliance which was named as the Bionator. Bionator belongs to which type of myofunctional appliance may be the question in your mind right now. Since we have already discussed myofunctional appliances and its classification in the previous video, it will become easy for us to understand to which category does a Bionator belong to. The Bionator is an appliance designed to be present on teeth and not on the tissues, so it is a type of a tooth bone appliance. Soft tissue stretch and muscle activity is used to produce the desired result, so it is a type of passive appliance. This type of appliance can be removed while eating and can be worn for the rest of the day, so Bionator comes under the removable category. Myodynamic appliances mean appliances which function using the muscular activity. A Bionator works similarly and so is myodynamic in function. According to Tom Graeber's classification, a Bionator comes under Group 2. Appliances belonging to Group 2 reposition mandible and transmit forces to the teeth. So, this is how a Bionator can be classified under myofunctional appliances. Another important point to remember is that this appliance should be used during the mixed dentition period. A Bionator is very similar to an activator, the only difference being that a Bionator is less bulkier. The essential concept for the functioning of a Bionator is its action on the tongue, which is the center of reflex activity in the oral cavity. It helps to improve the relationship between the jaws, tongue and teeth. It helps accomplish lip seal and they help to bring incisors into edge-to-edge relationship to achieve elongation of the mandible. A Bionator works by bringing the dorsum of the tongue backwards. The backward movement of the tongue enables its contact with the soft palate. This diagram will help you understand on how the relation of the tongue to the soft palate changes. Now let's discuss the different types of Bionators. First is the standard Bionator, which is also known as the neutral Bionator. This is a picture showing a standard Bionator. The standard appliance is used for the treatment of Class 2 Division 1 cases. It is also used in Class 1 malocclusions having narrow dental arches. The wire components of the standard Bionator are the Parietal Arch and the Vestibular Arch. Here this wire component is the Parietal Arch. The parietal arch is made up of 1.2 mm diameter wire. As we can see here, the parietal arch emerges opposite the middle of the first premolar and follows the contour of the palate, forming a curve that reaches the distal surface of first permanent molars. The parietal arch is kept 1 mm away from the mucosa. The second part of the wire component is the vestibular wire. In the diagram, this is the vestibular wire. It is made up of 0.9 mm stainless steel wire. It emerges from the acrylic below the contact point between the upper canines and premolars. It rises vertically and is bent at right angles to go distally along the middle of the upper premolar crowns. Measure to the molar, a rounded bend is made so that the wire runs at the level of the lower papilla up to the mandibular canine, where it is bent to reach the upper canines. It forms a mirror image on the other side. The vestibular wire is kept away from the surface of the incisors by the thickness of a sheet of paper. The lateral portions of the wire are sufficiently away from the teeth to allow expansion of the arch. The second component of the biometer after the wire component is the acrylic component. The acrylic component is horseshoe shaped. It fits into the lingual aspect of the mandibular arch and part of the maxillary arch. The next type of bionator is Class 3 appliance. This is a diagram showing on how a Class 3 appliance looks. This type of a bionator is used in mandibular prognathism. A Class 3 bionator is very similar to a standard bionator, except that the parietal arch is in the opposite direction. Here you can see how the parietal arch is in the opposite direction compared to a standard appliance. The next type of the appliance is the open bite appliance. This type of a bionator is used in open bite cases. The parietal arch and the vestibular wires are same as the standard appliance. The maxillary acrylic portion is modified so that even the anterior area is covered. Its purpose is to prevent the tongue from thrusting between the teeth, as the tongue is responsible in most cases for the open bite. Now let's understand the general structure of a bionator. As we know, there are two components. This is the wire component and this is the second component, which is the acrylic component. The acrylic component is made up of two parts. First one is the maxillary component and the second one is the mandibular component. The maxillary part covers two areas, which are the premolars and molars. This is the area which shows the maxillary part covering the premolars and molars. Then comes the mandibular part. The mandibular part covers the lingual surface of the mandibular teeth. This area in blue signifies the mandibular area. The maxillary part helps in preventing supra-eruption of teeth and also acts as a bite. The next component is the wire component. The wire component has two parts, which is the parietal arch and the vestibular wire. All the wire components are passive in nature. Here the bend which we can see is known as the puccinator's bend. Now let's discuss the various indications and contraindications for the use of a bionator. A bionator is mainly used for Class 2 Division 1 and Class 1 malocclusions having narrow arches. Then it is used in open bite cases wherein the open bite appliance is used. Then it is used in Class 3 cases wherein the Class 3 appliance is used. And there are few contraindications for the use of a bionator, which includes vertical growth pattern, that is when the patient shows vertical growth pattern, and also when the patient shows labial tipping of mandibular incisors. Now let's discuss the advantages and disadvantages. The advantages of a bionator over an activator includes that it is less bulkier, also that it can be worn day and night, and also that it is faster in action. The disadvantages of a bionator include that it is difficult to manage, it is difficult to stabilize, then there is selective grinding which is needed, also that it is more vulnerable to distortion. Bite registration is done in the same way as for the activator. In most cases, an edge-to-edge bite is desirable. If the overjet is too much, a stepwise advancement is preferred. Coming to the wear time of a bionator can be worn throughout the day, except while eating. Recall after 1 week to remove the sore spots is generally done. The interval between the visits is usually 3 to 5 weeks. Now let's revise what we have learned till now about the bionator by solving some multiple choice questions. Question 1. When is the right time for the use of a bionator? Option A, primary dentition. Option B, mixed dentition. Option C, permanent dentition. And option D, all of the above. Question 2. Bionator is a Option A, biodynamic appliance. Option B, passive appliance. Option C, removable appliance. Option D, all of the above. Question 3. Bionator is used in all of the following cases except Option A, open bite cases. Option B, class 3 cases. Option C, cases showing vertical growth pattern. Option D, class 2 division 1 cases. Take your time to answer these questions. You can later verify your answers by checking the description section below. Please like, comment and subscribe to the channel to learn more about various dental topics. You can also ask us any other questions or give suggestions in the comment section below.